health and a little wealth and a lot of love.
Yes. All right. So we talked about all of the risks associated. Like, what is the risks of people not having the surgery if this is an option that they're really looking at? Or another way of saying that, what are the benefits of this surgery that affords them? Like, this is a pretty, you're cutting into your stomach and all the other stuff. I'm just being real, right? Like, there's obviously some people who do this have to have it for some. The benefits have to outweigh the risks. So shoot.
Yeah, and something I did mention when we talked about what bariatric surgery was, now a lot of times they're able to do a lot laparoscopically. And so that means that instead of cutting into your stomach and causing a huge incision, then they do little tiny cuts, little tiny incisions, and they have equipment that's able to get in there through these tiny incisions.
Now, modern medicine, man, that is awesome. That's pretty cool.
So it's not as scary as some people think it might be. I know it's still a surgery, still a major surgery, but you're not going to end up with a huge scar down the middle of your stomach.
Right. That's good. So good cosmetics.
But benefits. The benefits are the benefits that you would see with extensive weight loss. So you're going to see, and some of this too, it's not just the weight loss, it's the surgery in and of itself because of the hormonal implications or the hormonal effects of the surgery, but you're going to see improving blood sugar. A lot of people are able to reverse their diabetes or at least significantly improve it to be able to stop taking insulin or a lot of their medications. You're lowering your cholesterol, you're decreasing fatty liver, so decreasing the fat deposits in your liver, which, by the way, cirrhosis now, so end-stage liver disease, a lot of people tie that to alcoholism and drinking alcohol, but we're seeing a lot more cirrhosis in people who are obese just because of fatty liver disease.
Because I'm taking a sip of alcohol
because
now.
It progresses to an end-stage liver disease.
What's that called again?
Fatty liver disease.
Fatty liver disease.
Yeah.
What was the technical term for that?
So non-alcoholic steatohepatitis or hepatitis is the mouthful. NASH. A lot of times we'll call it NASH.
NASH. I've heard of that before.
Mm-hmm. And then OSA, sleep apnea. So it can reverse sleep apnea. You can come off of blood pressure medication, so it can improve your blood pressure and all of the downstream effects of being able to be a healthy weight. So your functional status, people are able to move around better. They're able to exercise. They're able to play with their kids. They're able to work a job that they didn't think they would be able to work before. They don't have they might still have arthritis, but not as bad. A lot of people notice that the knee pain, especially, arthritis of the knees is tied to weight. And so there are so many benefits, I think, that if it's a last resort, if you feel like you get to the point where nothing else has worked and you're a candidate for this, especially if insurance pays for it, I think you should really think about it.
Right.
With a little health and a little wealth and a lot of love, that's a life that we live. Suits and scrubs.